Okay, so when I do a baby prep class, I one of the things that I focus on a lot is things that newborns do or have that are totally normal that every parent worries about, right? So sometimes babies can have clogged tear ducts. They worry about should we clean out wax in the ears. Really, there's nothing to do for those things. I mean, you can wipe away gunk from the eyes. That's totally fine. But there's no medication that you need unless the eye is looking red and irritated, in which case you can see your doctor. There's no need to be alarmed about tearing, like goopy eyes, because our tear ducts are so small at that age that they're so easy to clog up. Most of the time that goes away on its own. It's not something that will ever need medical attention, but occasionally if by 9 to 12 months the baby still has clogged tear ducts, then we address it. And so that, just to give you an idea of like how long that can go on and still be normal, right? So try not to worry about it. Wax should not be cleaned, right? I know that for some parents it's a little bit hard to understand, but we don't recommend Q-tips. You can clean the outside of the ears, but do not put a Q-tip anywhere near that little hole. Vaginal discharge is normal. If you have a baby girl, it is a normal thing, even bloody vaginal discharge. And that's something I usually tell parents before they even have their baby, because if that's something that I would have seen in my babies and I didn't know, of course I would freak out. So I try to tell parents that from the beginning so they don't get too nervous.
So,
Hiccups, yes.
Not discharge, but what about the white stuff that is down there in the private area?
It's totally normal.
So do we clean it off or just leave it?
Yeah, I mean, you can clean it, but I wouldn't be rough, right? So you're going to clean everything and get in the crevices and try to clean whatever you can, but don't like rub until it comes off. If it's not coming off easily, don't worry about it.
Okay.
Babies can have breast development, even boys, okay? The hormones that we give them when we're breastfeeding or through delivery sometimes can cause that. There's nothing to do. Even milk production occasionally you will see, even in boys, so don't be alarmed if you see that. Babies startle a lot. Sometimes they have like weird movements of their legs. All of those kind of weird movements, most of them are normal, right? If something is happening and you're really worried, don't hesitate to call your doctor and ask them, but most likely it's nothing to worry about. Babies can be very congested. That's normal too. And of course, spitting up is something that we see all the
time. So I think I interrupted you on the hiccups and sneezing also. And I know that a lot of times moms worry, my baby's sneezing a lot. Should I take them in? So I don't know if you want to address that.
Yeah, I mean, so sneezing and congestion they go hand in hand, right? Babies have very small nasal passages. They really only like to breathe through their nose. And so anything that gets in there makes them sneeze. And so we don't worry about sneezing. It's not something I would say you need to see your doctor for. It is a completely normal thing babies
do. So while we're on this subject, I think I'll ask a couple questions that came in if you're okay with that.
Sure.
So in regards to the clogged tear ducts, how often do I clean them, and do I use soap? How do we clean that portion of the body?
I would just use a warm washcloth, no soap, and really as often as it's bothering you. It's probably going to just reappear. As long as the baby's able to open their eyes and it's not bothering the baby, don't let it bother you. This is something that I say all the time. If it's not bothering your baby, don't let it bother you.
What about if their eyelids are crusted shut?
Yeah, then you can just use a warm washcloth to wipe it away.
Okay. So when do we know to call the doctor? If it's just red on their eyes?
Yeah, really if it's red on the inside. So if the baby opens their eyes and the white of their eye is red, that's something that you want to call the doctor for.
Okay. And then how do you suggest that I keep my baby from getting diaper rash and prevent any sort of rashness down there?
So the best way to prevent diaper rash is to use some sort of a barrier cream. And all of the creams that we use on the diaper area, whether it be Vaseline or, Desitin or Bomex, or, my personal favorite is called Calmoseptine. But basically all of those creams, their main function is not healing, okay? Their main function is prevention. So if you can put a thick layer of that on the diaper area to prevent the urine and the stool from irritating the skin, that's how they work. I happen to find Calmoseptine to be like a miracle cream when it comes to actually treating a diaper rash too. So it's my personal favorite. If your child does not have a diaper rash and you want to just go with Aquaphor or Vaseline, that's fine. It really matters less what you use in those situations as long as you're using a lot of it.
Okay. I've actually had my own battles with diaper rash with my third child. She just has a lot of eczema and extremely sensitive skin. And we have gone through periods where she literally had cracked skin and was bleeding down there. And it's just horrible because every time they poop, then it's acidic all over, their bum, and it's just so painful. And I mean, we would just take those times and let them air dry and lay down on a bunch of towels. And every time that they would instantly go to the bathroom, instantly change it out and do air dry days to help clear it up. Now, to prevent it, I'm telling you, when I cake stuff on, I cake it on.
Yeah.
And, I love all of the creams that you talked about, but I am a true believer of that Aquaphor. And also the zinc oxide, anything with zinc oxide in it, and a high amount of it has always been helpful for my babies.